wonderful, you do such important work, and I have to, realise that they think I'm a therapist, and I'm like, no, I'm not that kind of counsellor. I'm a Labour Party counsellor, and you can see their eyes just kind of fill with horror and start to kind of step away from me. Or they talk to me about bins or rubbish collection, and these are, of course, very important local issues, but they're not everything we do as a council, and I have the great privilege and responsibility of being responsible for many of Camden's people's services. So young people who've had a difficult start in life, older people, people with learning disabilities, people with mental health issues, people with physical disabilities. And when we talk sometimes in terms of services, and I think about this in the national debate, sometimes we can forget that focus on people. And in essence, we're all human beings, and we have the same desires to do something with our days that fills them with meaning, to have strong relationships, to have dignity, to have independence. And I think as we think about this whole debate around health and adult social care, I always try and keep that in mind and help that to steer the way forward. When I'm having these conversations at the moment, I have to start, I suppose, with some of the bad news and the difficulties that we're facing, because those people's-based services are at the moment facing enormous pressures. And I think probably most of you will have heard some of the debate over the last few weeks about the national crisis facing adult social care, and I'm sure also felt it in the work that you're doing. And I think it's not an exaggeration to say this is genuinely a national crisis. And there's been billions taken out of adult social care services around the country, and we've seen the effect of that in terms of providers struggling for sustainability, councils of all political colours talking about really struggling to provide basic services for individuals. And we saw Simon Stevens, the chief executive of the NHS, saying if there's any money in the system, it should go into adult social care, because the really difficult winter we've seen for both health and adult social care services is connected to that reduction in adult social care spending. So we see increases in people going into hospital who don't need to be, or struggling to get back into the community, because around the country adult social care services are not there to support people and to support them to stay in the community. And it's a national crisis, and some people will have seen the debates around Surrey Council saying that they were going to increase their council tax by 15%, and then drawing back on that with some kind of unspecific deal. And I think as councillors, we want any kind of deal for councils to go around the country to deal with the huge pressures we face. But in Camden, we do have a huge amount of strengths in dealing with this crisis. And the strengths, they're in this room. They're the incredibly strong voluntary sector, the whole range of organisations, and the fact that I see so many of you at different events, and the commitment to delivering services. I think the very close relationship between Camden Council and the CCG, and me and Cass see each other so often that she's able to diagnose my flu and give me different health advice as I go along, so I don't even have to visit a GP. But we have a strong shared values locally, which I think is incredibly important. Where as a borough we pay the living wage and we support our care sector, and I'll talk a little bit more about that later. But we do still face the same challenges, and I think it's three things. One is the rising demand. People are living longer. People with complex learning difficulties are living longer. Older people are living longer, and they're living longer in poorer health. That's something really to celebrate, and we imagine that over the next 10 years the number of over 70s in the borough will double, and we have, as Kaz mentioned, a really high prevalence of people with mental health issues. So we see this rising demand, and we've been given new responsibilities as local authorities by the government. So under the Care Act, we're being asked to do more, but we're not seeing funding to meet those new responsibilities. In fact, we're seeing the opposite. We're seeing huge cuts, and Camden has lost half its discretionary budget. So we're trying to do more with less money, which is a really difficult place to be in. And when I inherited this portfolio, I inherited a set of savings that we'd agreed to make by 2017-18 of £16 million. And we were really struggling to make those savings because of that rising demand at the same time as these new responsibilities under the Care Act. So what we've been doing over the last kind of 6 months is thinking through our strategy and how we can address these funding pressures. And I think what we've done is twofold. One is to look at everything we do and to ask how we can save money and how we can do things more efficiently. But the second is to think about how we can really transform our services in conjunction with the voluntary sector, with the CCG and other partners to prevent people falling into more ill health, to keep people independent for longer. And I think we have been really good often at keeping people safe, but we want to look at people not just through the lens of their vulnerabilities, but also their potential, asking where people can, helping them into work, helping them into community facilities, helping them to live more independent lives. And as part of that transformation, we are proposing to bring in the adult social care precept. I don't know if people know it's the 3% of your council tax that you can bring in to go specifically into adult social care services. So we're proposing to bring that at the maximum amount we can without a referendum, which is 6%. And we want to invest that money in service transformation. But as I said, there are some difficult decisions as well, and we are looking at the moment at updating our contributions policy to be in line with the Local Care Act, or the National Care Act, which will mean that some people need to pay more, and there's a consultation going on about that, and I know that some people in this room have seen at the consultation events. We've also seen a decrease in the number of people using our day centres, so one of our proposals is to merge some of our day centres to meet the future need, and again, we're currently consulting about that. But in terms of the future strategy and the transformation, that's what I really wanted to talk to you today about, and the potential to work with the voluntary sector around that. And there were 3 areas that I just wanted to flag. One is the Centre for Independent Living. So people have probably heard for many years talk of Greenwood Place and the Centre for Independent Living, but we've just actually published the procurement strategy for the Centre for Independent Living, where we're asking local organisations that work with people with disabilities to come forward to bid to run the new Centre for Independent Living. And we want that to be a centre which supports people to live independently, which is a really strong voice for experts by experience with people with disabilities and learning disabilities in the borough. Not just a strong voice to talk to the council, but also a strong voice to talk to employers to make sure they're making the necessary adjustments to give people work, a strong voice to talk to the CCG, to the police, to other public sector partners. And I think that's a huge, huge opportunity for organisations in this room who might want to be part of a partnership that bids for the Centre for Independent Living, but also when it's in place to create a really strong network of organisations that are supporting people across the borough. So I hope people will look at that strategy. We're putting seed funding into it and consider being part of that journey. The second thing I wanted to mention that Kaz touched on is on our strategy around home care. So at the moment we're getting ready to re-procure our home care contracts. And what we're proposing in our new strategy is to ask for home care agencies to work across 4 to 5 hubs in the borough and to work really, really closely with GPs, with other health practitioners. So they really build relationships with families, with carers, with GPs, rather than somebody coming in that people don't necessarily know and seeing a different person each week, and to really build those relationships, but also to invest in staff. Because I think that when we think about carers, sometimes these can be some of the most underappreciated and underpaid workers in our society, and that's why in Camden we choose to pay the living wage, but we also want to develop skills. And I think, as Kaz was saying, asking the enhanced home care offer is also about developing carers' skills and opportunities within the sector, having people close in the geographic area so they're not losing a lot of time travelling around, and also signing up to the Ethical Care Charter, which means people are reimbursed for their travel. So we want these to be good quality jobs which can be for Camden residents, but we also want citizens who need our support, I don't like the word customers, to really get that holistic support where health and adult social care are working together, and we're very committed to that local integration. And I'm not going to go into the wider STP discussion now, but if people have questions for me about that, I'm really happy to talk about it, except to say that we don't see integration as a replacement for a properly funded health and adult social care system, and we're committed in Camden to working on that local integration, but I will also be continuing to campaign for proper funding, both for adult social care and health. And so the kind of final thing I just wanted to mention as an opportunity is a broader one. When I talk about the investment from the precept and our transformation strategy, that is something we're really developing. We've had sessions with the voluntary sector to talk about ideas for that strategy, but we really want this to be something we draw up in partnership, because at a time of really genuinely constrained resources, we can only do this effectively if we work really closely together, if we're equal partners, if we're listening to each other. So I really, really welcome ideas about how we develop that neighbourhood approach, how voluntary sector organisations can play a role in linking in to home care, to other health professionals working in a neighbourhood, how you think Camden should be investing in transformation. And as I say, there's a consultation going on at the moment, and I hope that everyone will be part of that and give us your ideas. And then I suppose for me as a politician and somebody who really cares about adult social care services, I also just wanted to say something about the campaigning point, because I think that the professional circles, I think there's a really strong knowledge of a gap facing adult social care, but I don't think that it's really reached the public consciousness. I don't think the stories of individuals and what this really means has. And I met last week